my name is Gallagher. I am a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. Okay, so I'm going to explain why we made a change in our practice. Previously, for patients who are undergoing vaginoplasty, we used to make them do a bowel prep. Now, first of all, what is a bowel prep? Anybody who's ever had a colonoscopy knows exactly what that is, and it's where we give you quite a bit of laxatives and antibiotics, and the idea is we're going to clean out your intestines. Obviously very necessary for a colonoscopy because we need to be able to see what's up there with the scope. And so it previously was my practice to make our unfortunate patients, and I apologize, who were undergoing vaginoplasty do the same preparation. So they would be starting the day before around 3 p.m. beginning to take some laxatives and antibiotics, and then kind of dealing with the consequences in the hours leading up to surgery, oftentimes making the drive to the hospital pretty unpleasant for many girls. So it's one of my big philosophies, probably one of my biggest influences in my career is a book called The House of God. And so for those of you who've never heard of this book, this is an absolute classic, and most doctors or med students will read this at some point. And basically it talks about a young intern who came through in the 80s, maybe it was the 70s, was doing his intern year, and basically it just describes in the most dramatic fashion the carnage that went on around him and the harm, like to his horror, himself and his colleagues were causing to patients. And then towards the end of their intern year, they suddenly realized something, that the less they did to patients, the less that went on. And so in that spirit, they began to do less and less, and the patients did better and better. And so I think I really adopted that into my practice. If there's any sort of minimalism that can be applied to a procedure, if there's anything unpleasant we can leave out, we love to do that. And so the most recent thing we've gotten rid of is the need for a bowel prep. So what I believe is a lot of plastic surgeons and surgeons who trained me came from a general surgery background. So I'm from a general surgery background, and it is pretty much blasphemy in a general surgery mindset to operate on a colon without first preparing it or doing the bowel prep. It's something that's been argued over the years and has come out in favor of doing the bowel prep. And so the idea is when we're operating on that colon to try and get everything cleaner, as it were, by reducing the bacterial load and the stool that's in there. However, when we're doing vaginoplasty, we're really trying to stay out of the rectum and the colon. We don't want to go in there at all. So really, the closer to what we're doing is a procedure like a prostatectomy, or removing the prostate, which is what urologists do obviously all the time. And so at Indiana University, we have a really robust urology department who do prostatectomies all the time. And I was very interested to find out that they do not bowel prep their patients, even though they're right down there in the same plane as I am when I'm doing vaginoplasties. So I went to the urology literature and I took a look at this, and probably the most definitive study to answer this question is a huge study out of Japan. And in this study, basically they looked at men undergoing prostatectomies and tried to figure out if there was a difference, whether or not if the rectum was injured by accident, if there was a difference in how those patients did afterwards. Because of course the thought was, if you clean out that rectum and we injure it by accident, you're more likely to be able to just repair it and not have to give the patient a temporary bag. So what they found was, and huge numbers of patients for this study, with something like, I think it was 150 rectal injuries, which is very rare in prostatectomy. So what they found was there was no difference in between the patients who were bowel prepped and the patients who weren't bowel prepped, or bowel prepped as Americans say. So for that reason, we decided to forgo this unpleasant step in vaginoplasty, and other centers also around the United States are forgoing this, which I think is good development.